LSI 2021 at the beautiful Ritz-Carlton Laguna Niguel. It's nearly true tales of innovation. I'm your host, Benjamin Glenn. My guest is Kwame Ulmer. Kwame, it's great to have you here with me today.
Oh, Ben, it's a true pleasure.
So here we are at LSI 2021, first live event for me. How about you?
It is. I got up here first thing this morning. I was so excited to get here.
What brings you out? What are you talking about at the conference this year?
So this year I'm going to be meeting with some early stage and growth stage investors who are focused on medtech. And really we're going to talk about what they learned about 2020, practical advice for the early stage CEO, what they're excited about for 2021 and beyond. So we're going to talk about trends, and I'm fortunate enough to be a moderator in that session.
Oh, terrific. So your panel is made up of CEOs, or who else? What's the mix look like?
All investors. So from intuitive to long-standing funds that can take you from seed all the way to exit, to funds like Wavemaker Three-Sixty Health, which focuses on seed to Series A.
Seed to A. Yeah, it's so important. I find that that's one of the disconnects between the young entrepreneur and the investor, is that establishing that what kind of where do you like to place your wallet, and having them understand, are you seed, are you A, you want revenue? So you're probably going to help them crack that code.
Yeah, I'm excited about that because we actually are going to ask people to tell stories just like this that really crystallize what type of company is appropriate for their fund. And they're like profiles of funds. There's the classic growth fund that won't talk to you until you have your 510K or 5 million in revenue. And then there are the early stage funds who have, I like to call it belief capital. They will make an investment before you even get your 510K. And knowing those differences, like you said, is important.
So Kwame, you used the term belief capital. Tell me about belief capital. What is that?
I can't say that I came up with it, but the first time I heard it, I thought it's perfect for where Wavemaker 360 invests. So there's this classic Valley Death. That term has been around forever. And it really is the stage when a company has a working prototype. They don't have that next milestone of FDA clearance, and they probably have received as much non-dilutive capital from the government that they are going to get, but they still need more. And there's a small group of investors, some family offices, angel investors, and even smaller group of institutional investors who provide that capital to get them to that first milestone, which is a 510K de novo.
Yeah.
Yeah.
So,
that's belief capital.
Yes,
believe in early.
I believe you're going to get through the FDA. Well, you know a little bit about how things work at the FDA, don't you?
I'm fortunate enough to say that I've spent 19 years in this space, 12 at the FDA.
12 at FDA. Mm-hmm. So can you tell me more about how do you bring that FDA knowledge to bear as an investor when you're advising? How has that shaped your perspective on the industry?
Having reviewed and been a part of hundreds of applications and meeting with hundreds of CEOs, it allows me to calibrate the early stage company quicker. When I say calibrate, I was just talking to a company who is planning to launch a high-risk PMA device in the US and similar devices have had compliance actions already taken.
Wow.
And so for that company, they are clear-eyed that it's going to be a multi-year journey with multiple interactions with the FDA to convince them that their product quite candidly is safe. Sometimes I talk with wearables companies where their device may be a class 1 or their product may be under enforcement discretion, and that calibration of the types of data and information they need is quite different the team they need, the skill sets is slightly different than on that end of the spectrum what you need for a PMA device.
So you're kind of helping them sort of right size the talent.
Right, because I'm typically meeting companies who are a team of between 2 to 5, and they want to launch a digital health company. And so I actually give them a list of the types of skills that they would need to onboard and when, and maybe even make a cut between who can be a consultant and who needs to be a full-time employee.
Oh, wow.
Because we're seeing a fair amount, and a lot of people are talking about this. It's going to be a topic of discussion for this conference. These non-traditional entrants, these former Google coders who think they can build a digital health solution, and they don't know what they don't know. So giving them some thoughts about the team they need to build a regulated digital health company.
Oh, that's very important. Yeah, I love that know what you don't know. It seems like you're also helping them sort of bring forward later stage decision making. Can you talk about that? I think maybe at the agency, when you were at FDA, CMS data, FDA data, maybe you can ride both those horses at once. Can you talk about that?
Absolutely. There's an underutilized program where you can get feedback on the reimbursement clinical study or clinical data you would need, and the type of study you need to do for FDA clearance, de novo, et cetera. And it is still underutilized. The savviest of companies are at least thinking about reimbursement at the same time they're thinking about the FDA. Mm-hmm. So I think folks like Don at the Office of Science and Engineering Laboratories, they're great at the FDA because they still believe in these tools and they're still building tools that early stage innovators will need, not just for the FDA, but also potentially for CMS.
It makes me want to get your tagline in here, right? Before you talk to the FDA, talk to the FDA.
I appreciate it. The check is in the mail.
That was free. That was free. Didn't you join Anderson here a few months back?
Well, I was fortunate enough and really grateful to be asked to join Jennifer McKinney. And we've been doing some lecturing on medtech innovation, but also some really amazing research that I think will be impactful for the industry.
That's funny because I've been doing a lot of biomedical innovation with Jennifer McKinney. Let's bring Jennifer McKinney into this conversation.
Jennifer.
Jennifer.